Welcome back. My next guest is Miss Shelley Roberts, who is a pharmacist with Grassroots Pharmacy. Welcome.
Well, thank you.
All right, now the traditional role of the pharmacist used to be you give them a prescription, you count the pills, you put them in the bottle, and you give them, and off the patient goes. And that's still part of it, so tell me about that part, but it's really changed a lot.
It has been changing a lot in the last several years. Yes, we do dispense prescriptions, but we do so much more. We've been, offering immunizations and counseling patients on drug interactions and always looking out for those allergies, interactions between medications. But at Grassroots Pharmacy, we're taking it a step further, and we want to be a hub for your health. So we want to be able to direct you to nutritionists for your nutritional care and be able to direct you to different exercise groups and even have some going on at our pharmacy, because we really understand that your health is not just about taking a pill every day. It's about getting better and healthier, and it entails a lot of different things. So we want to be a hub for that. And as pharmacists, we're easily accessible. So it's definitely how our role is changing.
Now, you mentioned drug interactions. A lot of patients, especially elderly patients with a lot of diseases, come to get a prescription and they have a lot of medicines. Part of your job is to make sure those don't interact.
Right. Part of our job is making sure that they don't interact, because let's face it, people can have multiple doctors prescribing multiple things, and we're kind of that one place where they're getting all of them. So not only are we checking all of those medications to make sure that it's okay to take all of them, we also may be making some recommendations on how we can, tailor your care, maybe remove some of those drugs under your doctor's supervision and really help you out with that portion.
Now, there's also interactions, but there's also side effects. I'm assuming you maybe counsel with some of the side effects, but a better question for me is, how do you keep people from worrying about the side effects? They get that list and everything in the world to think the drug's going to kill them.
It is true. Whenever you get that, it can be overwhelming as a patient to see this whole list of side effects. And it's our job to kind of reassure you, we do have to list all of those interactions. And if you experience something, talk to us, and we can walk you through those concerns. And we have a good understanding of what needs attention at the time and what doesn't. So it's always, that's why we try to be so open and easy to access, so that you can discuss that with us.
Now, you also mentioned nutrition and exercise, and off the air you were telling me about a kale smoothie.
A kale smoothie, yes. So, like I said, at Grassroots, we're really trying to hone in on nutrition as part of your health plan for yourself. And so we have a smoothie bar, and everybody that comes in, I try to get, let me make you a kale smoothie, because we sometimes fail to realize that we can get so many vitamins and nutrients from the food that we eat instead of just taking a supplement. Supplements are great, but if we can get it from the food that we eat, that's even better.
I think, though, I'm going to take a supplement rather than a kale smoothie. I just don't know if I could do that. But you mentioned supplements, and that's a lot of people take a lot of over-the-counter medications that may interact with their prescription medicines, and the pharmacist is in a place to help advise them with that.
Exactly, and that's what makes me so excited about this pharmacy that we've opened, is that we encourage people to come in and talk to me about your supplements. I'm not going to balk at the idea that you're taking a supplement, and because I want to know about them, because I know what medicines you're taking and if there is an interaction that exists, versus you going to just a vitamin store, picking up something off the shelf and not letting another healthcare provider know what you're taking, because those interactions can exist.
And you mentioned interactions, and there are side effects to medications, but just because it's natural or it's a vitamin or it's a supplement doesn't mean it doesn't have potential side effects.
That is true, and yet another reason why, if you talk to your pharmacist, if you talk to your doctor about the supplements that you're taking, we have the best advice we can give you about what can happen as far as side effects of natural, because natural doesn't always mean safe. We do have to be careful about the products that we are purchasing, because you don't always know what's in them, because they're not regulated the same as prescription drugs are.
Well, give me some examples of I don't know what the right word is, some of the supplements now that a lot of people are looking at. They seem to come in waves. And one time we saw melatonin in the St. John's wort. And what's the supplement of the day?
Melatonin is still pretty big. Melatonin has been a big one for sleep. A lot of coenzyme Q10 for people who are on statins. We have a lot of people coming in a lot of people come in still looking for diet supplements to lose weight, and that's where I feel like I can really use the different programs we have going on in the pharmacy, like the nutritional stuff that we do, free yoga on the patio, and are doing couch to 5K programs. Where it's an opportunity for me to talk to them about those things.
So you like nutrition, diet, supplements, and there's even newer weight loss medications that have been out in the last year for long-term weight loss.
Yeah, and when somebody comes in and they're concerned about their weight, we get to discuss those things like, well, we have these prescription options, we have these supplement options, these are what's safe for you based on your medical history that we can see here, because we know what you're taking, we know if you have high blood pressure and what's going on with you.
It's great information. Thanks for coming in.